Hi, I'm Zachary Blanchard, and the topic we are presenting is virtual reality and the recovery process of patients. I, along with Kira Downs and Natalie Sawczek, will take you on a journey discussing the use, benefits, along with other crucial aspects that go into virtual reality in the healthcare system as a whole. Virtual reality originally started out as a video game experience and later broadened its horizons to different sectors of industries, arguably the most beneficial sector being healthcare, specifically the recovery of patients and how it can reduce pain. Virtual reality functions by using visuals and sometimes audio effects to stimulate a situation or world which you can interact. Some people say this is a leisure distracting from your everyday world. However, what happens when you have a significant change to your daily life due to an accident or illness? When utilized in clinical settings, VR can be an effective tool to alleviate pain in the form of distraction. Virtual reality takes patients into a three-dimensional world that takes them away from their pain. Most settings are generally peaceful, such as a nice sunset, walks on a beach, or a snowy environment, but can vary depending on the patient's desires and feelings. Virtual reality is not just changing the way patients receive pain signals, but can reduce the amount of pain-related brain activity.
One unique benefit that comes out of virtual reality is treatment for patients that are experiencing post-amputation phantom limb pain, or PLP for short. PLP is caused due to the musculoskeletal and neurological dysfunction that comes out of the loss of a limb. For patients, there is a neurological lapse between the motor signals and the visual feedback they are seeing due to the loss of their limb. This takes a while to get used to, and virtual reality aids in this process by acting as an enhanced version of mirror therapy, which has been the standard to treat PLP in recent years. VR allows for the patient to perform tasks that feel like they still have that limb present and slowly integrates them into accepting that they do not, allowing for the central nervous system in a sense to be rewired to adjust to the loss of the limb and its use. VR also helps in the treatment of phobias. A phobia is defined as an extreme or irrational fear of something, with common phobias including spiders, heights, snakes, airplanes, and public speaking. The use of VR is to get them used to the idea of their fear by putting them in a graphic simulation with their biggest fears. For example, arachnophobia, which is the fear of spiders, can be treated with a simulated tarantula on a kitchen table where the patient controls their distance from the spider and can even touch the inanimate creature. After virtual reality treatment, most phobia patients have reported a significant decrease in anxiety and actually began to start interacting with their fears in some cases. VR can even help with PTSD through the same method of exposure therapy. Virtual reality has been utilized for significant progress in the surgical field. Immersive 3D virtual reality models of the human body allow for surgeons to rehearse and practice for a surgical procedure before even making an incision. Studies have shown that the ability to visualize and manipulate structures in 3D space has proven to be important to both confidence and performance in identifying neuroanatomic structures. Virtual reality surgical rehearsals could lead to an increase in accuracy in surgery with fewer complications and deaths, especially in sensitive neurosurgeries.
Virtual reality technology in a rehabilitation setting can provide patients with a more immersive environment so that they are able to simultaneously stimulate their cognitive and motor functions. The economic implications associated with virtual reality therapy in the healthcare field have also shown promising results. Opioid prescriptions are a common form of pain management that can cause a variety of side effects like sedation, nausea, and constipation. When patients suffer more side effects, it prolongs the length of stay, decreases patient satisfaction, and increases healthcare costs. Recent medical studies have found that virtual reality therapy programs have combated these issues and even reduced the use of opioids for pain management. The average overall hospitalization cost savings per patient utilizing the VR program was around $99 when compared to traditional care methods. The hospital in the study also found that an average of $17 was lost per patient who refused to receive virtual reality therapy. In this time period, the United States' cultural beliefs and economic values are centered around technological innovations. Patients have the mindset that the latest medical technology will result in the most effective treatment. In the healthcare industry, virtual reality was noted to have generated $240 million in revenue in 2018 and is estimated to reach $2.4 billion by 2026. Virtual reality is being integrated into multiple sectors of the healthcare industry. In the hospital setting, it has been applied in patient education, robotic surgery, mental health, and physical therapy. Doctor consultations can also be given through virtual reality equipment and offer a more empathetic experience for patients. Medical schools have even begun to use virtual reality to deliver interactive clinical training to students. The market for virtual reality is continuously growing, and new uses for VR will continue to be discovered every day. Are you ready for the future? Okay, now it's time for discussion questions. Would virtual reality be beneficial if you were a patient suffering from a condition? Why or why not? And if so, how long do you believe virtual reality stimulation should last during recovery? Also, what other areas of the medical sector not specifically addressed in the presentation do you think virtual reality could be incorporated in, and why?